Okay, well, our last talk will be by Dr. Gabriela PALIS, who is from Buenos Aires, Argentina, and she is going to talk on planning medical education events with AI.
Is it working?
It did when you tapped.
Can you hear me well?
Yeah.
Okay, thank you. So I have no conflicts of interest to disclose. And my talk will be about lesson planning with artificial intelligence, particularly with ChatGPT. So when we think about lesson planning, usually we think about what our objectives are going to be, what is the content that we are going to include in our lesson. But it also takes other steps, such as the activities that we are going to include, the homework assignments we are going to give to our students, and how we are going to assess them. So ChatGPT, have any of you used ChatGPT for planning lessons or for planning an educational event? Have you used ChatGPT at all for anything else? Okay. So the GPT part comes from Generative Pre-trained Transformer, and by definition it's an artificial intelligence language model that uses deep learning to generate human-like text responses based on the input it receives. In easy words, it means that you can talk to it and it will provide answers as if it were a human being. It's not, but as if it were a human being. There are several versions. Some are free, some are, you have to pay for them. And there have been already several publications about the use of ChatGPT and artificial intelligence for medical education. So Carl already mentioned the one by BIMI, and I'm going to focus only on the publications that are either systematic or scoping reviews. This one was conducted in the US, and it showed out that the potential benefits are novel learning strategies, where you will be, sorry. So you will be able to develop personalized learning plans, create learning materials, and provide feedback to your students. This one conducted in China shows that it's being used widely for developing personalized learning plans and materials, or for creating realistic clinical practice simulation scenarios, among other uses. This one also conducted in the US. This one was published this year, and it showed potential benefits for crafting script concordance tests and exam questions and simulated case presentations. So just to show an example of how this works, I asked ChatGPT to prepare a 2-hour lesson for medical students on the red eye. I asked it to define the learning objectives and to list the activities that should join the content of the lesson. So if you haven't seen how this works before, this is the main web page. So it's mostly blank. You have down here at the bottom search text, and this is where you will write your instructions for ChatGPT. So this is not for you to read it all, but it's to show you that in less than 30 seconds, I got a whole plan with the learning objectives, the lesson plan outline, with all the activities, how much time the activities should take, in a very, very fast time. If I had to do all this and write it down, all this on my own, it would have taken a lot more time. So we're not going to read all of it, but just to show you a few examples. I got the title, the objectives for the medical students to understand the common causes of a red eye, to describe the clinical features associated, etc. I got what materials I needed, the PowerPoint presentation, the whiteboard makers, the case studies, what I should cover in the introduction, Then 20 minutes to be spent on the causes of a red eye and the different parts of it, to use the PowerPoint to explain, to discuss the typical clinical features with the students. Each part of the lesson that followed had the exact time that I should take on everything. For example, 25 minutes for the clinical evaluation, 15 minutes for the case studies, 10 minutes for the differentials, 15 minutes for the question and answers, the homework and assessment. Carl mentioned before the slides, and although ChatGPT does not provide you with the full slide with all the pictures and everything, it gives you, as he said, a draft of what you should include in each slide. So the first one, it suggested to include the title slide. On the next one, the introduction with a definition and the importance, etc. Then I asked it to list the activities that I should include with the lesson. And usually we think about, when we think about these, we think about case discussions, sometimes a little simulation, but usually that is all. Well, ChatGPT provided me with a list of more than 10 activities that I could include with my students on different, on the same topic, but with different activities, such as case-based discussions, simulation or role play, peer teaching, peer evaluation, interactive quizzes, the role of the eye specialist, debate on treatment options, etc. Then I asked it to create an assessment plan for the lesson, so it gave me the formative assessment during the lesson and the summative assessment at the end of the lesson and what I should do in every moment. And it also provided the grading, the scoring, the feedback, and the follow-up. I also asked it to provide the assessment for each of the objectives. So it gave me, for each objective, how should I assess each of them? So for example, for understanding the causes of a red eye, with a written or oral examination. But for developing a systematic approach to diagnosing the underlying condition, maybe a case-based scenario would be a better way of assessing the student. I asked it to design the homework assignment, so it told me to generate, I asked it to generate 5 problem-based learning cases for medical students about the red eye, so it provided me with a case about acute conjunctivitis, another case about the ocular foreign body, etc. I asked it to create some questions for testing the knowledge of the common causes of a red eye, and here is where you have to be careful, because sometimes the answers or the confounders it provides are too easy, even for medical students. So here it's asking which of the following is not a common cause of a red eye. Of course, anyone would say otitis media. But if you asked it to refine the question, or you tell it that the answer is not appropriate, it will change it to make it better. I asked it to provide feedback for each of the answers. So if you are, for example, preparing an e-learning test and you want your students to receive the feedback, it will be giving also the feedback. So what are the ChatGPT limitations? That may occasionally generate incorrect information, and our colleague mentioned the references. And this is something that it's something to be very thoughtful about, because as with many great doctors, ChatGPT never says, I don't know. It usually invents something. So you have to be careful and check out all the references, because many times they do not really exist, or they are, it does not take you to the correct reference. Recommendations for teachers, and Carl already provided many, to verify the safety, the reliability and repeatability of what ChatGPT suggests, to assess the impact on the content and the quality of teaching, and to establish diverse assessment methods for the students. So for assessing knowledge, maybe ChatGPT could provide excellent suggestions, but if you're going to assess if your student can examine a patient, maybe you have to select a different kind of assessment. Some tips for writing prompts. Prompts are the instructions that you will give ChatGPT on what it has to do. Be specific and concise. Use smart keywords, and especially action words such as create, list, generate, build. Identify a purpose, specify the audience. Tell it that you need this for residents, or that you need this for medical students. Provide a context. This is for medical students in their 4th year of medicine, or this is for medical students who are having their first contact with medicine or with ophthalmology. So I think that ChatGPT can be, and artificial intelligence in general, can be a great assistant. It will make you save a lot of time. It's not perfect. You'll have to go with it. You have to review what it provides. But I think that it's a great assistant, will give you a lot of very good ideas, and will help you save time. So thank you.
Any questions? Yes. You please use the mic.
Thanks, Gab, for the excellent talk. So ChatGPT is the most commonly and most popular AI platform. Do you recommend any other alternatives to ChatGPT which are more specific for after education? That's one part of the question. And second question to our colleagues from Hong Kong. I see DeepSeek being the upcoming alternative for ChatGPT. Do you see DeepSeek being a better, or have you had experience in using DeepSeek for creating better opthal content for teachers? Thank you.
To the first question, I actually have used only ChatGPT, so I don't have experience with other chatbots. Maybe you do?